Okay, can you all see my slide? Am I clear? All right. So good afternoon, everyone. My name is Dr Nazirah Azman. I'm one of the medical officer in the psychiatry department, currently also working in HPP. So today I'm very honored to be presenting on this topic with regards to the hope for recovery. I'm sure a lot of you out there are actually quite keen to actually know what recovery is all about, right? So today, without further ado, I would like to present on some of the points that would probably be beneficial for all of you out there. Okay, so moving on. Okay, so by the end of this session, among the objectives I wish to achieve is for us all to realistically understand the concept of recovery, the concept of rehabilitation. Secondly, I would like for us to have or find a level of expectation that is both practical and also acceptable, then actively work up on what are the achievable goals within that level. We'll talk about this level of expectations in a while. And last but not least, the objective of this presentation is that we can be better informed about the relevant mental health rehab professionals, and we know how to express our needs when we are seeking for help. Okay, so the contents of my presentations are as listed. First and foremost, I'll be talking with regards to the definition of recovery, what is needed for recovery, and factors attributing to poor treatment outcomes, the role of family in recovery, and last but not least, with regards to the rehabilitation team. Okay, so I know it's lunchtime and probably a lot of you are quite tired already with the two previous lectures. So we'll make it a bit more interactive. So can Denise please launch the polls? We're going to do a poll and I want to see what you guys out there think with regards to these three questions. Okay. So the first question is, do you believe that persons with mental illness are generally curable? So there's no wrong answer to this question. So you can answer whether you absolutely do not believe that persons with mental illness are generally curable, or you believe that they probably have little chance of being cured, whether they have large chance, or whether you actually absolutely believe that people with mental illness are curable. The second question is, do you believe that the person with mental illness in your family will recover? So the answers are also similar like the first question. Okay, I can see some people are responding to these questions. Okay, I'll talk about the third question also while we're at it. Okay, the third question is talking about what do you currently expect of your mentally ill family members? So this is actually multiple choice. You can answer more than one, and you can choose more than one answer. Okay, so I'll leave you guys to answering the questions first. Okay, so has everyone voted? Or should we give some more time, Denise?
I think in 1 minute.
All right.
Hello, I just wonder that whether participants, they all know how to use the polling function or not.
Oh, okay. Denise, do you mind sharing how to vote?
Usually it will appear right on your screen, so you just need to click For the first question, there would be single choice question. Then I think you just need to click it. Click the option. Yeah.
Is there anyone having problems with the vote and polling system? You can voice out here also. Okay, all right. So yeah, let's take a look at the votes. Hold on, can we share the results? Share results. All right. So can everyone see the results of the polls? So I can see here that for the first question, quite a number of us, at least about 62% that believe persons with mental illness are generally curable. So that's very good. We still, a lot of you guys out there are quite optimistic with regards to cure in mental illness. The second question, do you believe that the person with mental illness in your family will recover? The majority of us answered there's actually quite a large chance, okay, at least 46% of us. And the last question, what do you currently expect of your mentally ill family members? 50% expects family members to be able to work. 12% expect that they don't need to take medication or have follow-up anymore. 8% expect that there's no symptoms. 38% expect that not troubled by side effects of medications. 100% of you all answered the expectation is to be able to take care of themselves. So this is agreeable by everyone, I guess. And about 50% wish and expect that there's no relapse for years. And 73% expects there's steady emotions. Yeah, all these are actually quite valid expectations from family members. I do get this kind of responses from my patients' family from time to time. Okay, so we will go through with regards to the perspectives, different perspectives in recovery, because although family members of patients with mental illness have their expectations or have their perspectives, but if we look at it in a more general term, in terms of the general public, the family members of those with mental illness, and even the medical practitioners, they have different perspectives in recovery. Okay, for example, those in the general public, they probably do not have much understanding with regards to mental illness. So they would probably be expecting or have their own perspective that recovery means the person with mental illness appears normal. Recovery means that they actually they are already discharged from mental health hospital. But for family members, on the other hand, their perspectives on recovery would probably be looking to in terms of function, like for example, they're in terms of able to work or able to go back to school, able to care for themselves, like the answers just now, all of you responded that, able to take care of their family and to be not having symptoms. As for doctors or medical practitioners, on the other hand, recovery for us in the medical field would probably be talking about targeting reducing of the symptoms and restoration of function. Okay, function is a very important component in recovery that we look on when we talk about recovery in mental illness. And we would also be looking into relapse prevention. Relapse is talking about having a recurrence of the episode of the illness. Okay, and also not to forget, we would also try to target absence or at least minimal medication side effects so that our patient would be comfortable with the medications that we prescribe. So now we look on to what is the definition of recovery in terms of the World Health Organization. Okay, what recovery really means. Okay, if you look at this slide, it's talking about recovery is about regaining control of their identity and life, having hope for their life, and living a life that has meaning for them, whether through work, whether through relationships, whether through community engagements, or some of all, or even all of this. Okay, so this is actually based on the World Health Organization promoting recovery in mental health and related services 2017. All right. Actually, when we talk about recovery, it no longer means just being cured from the disease or being normal, having no symptoms. Okay, we know that mental illness does not only cause physical problems but also affect the daily living ability, as we can see. So, when we talk about real recovery, it does not simply mean control of symptoms, but we also talk in terms of having good psychological adjustment, having to be able to integrate back into community, reintegrate back into society. So real recovery means actually more than just being without symptoms actually. Okay, so after we know what recovery is all about, what is the definition of recovery, it's also important for us to know what is needed for recovery. What are the factors influencing recovery? So first and foremost, it's very important to be talking with regards to good medical treatment. For someone with mental illness to be achieving recovery period, they would really need a good medical treatment. Okay, what it means by this is that they are on medication that is suitable for them, that is appropriate to their diagnosis, and they are taking it accordingly as what has been prescribed from the doctor, not just taking in terms of whether, you know, whether they feel like they want to take and stop when they don't feel like they don't want to take. So good medical treatment is also encompassing in terms of adherence to the medication. All right. So secondly, when we talk about what is needed for recovery, non-pharmacological treatment is also important. So here it's talking about, for example, counseling session, psychological session, you know, or rehab session with the occupational therapist. Those are also important in building back the person so that he or she can be functional and can be back to the community. All right. So thirdly, it's talking about having good insight. Insight actually means that the person with mental illness is aware that they have the symptoms of mental illness. They attributed that the symptoms that they have is due to the mental illness, and also can be accepting that they are having more about this later on. All right. Good family support is also important in terms of influencing recovery process, because studies have shown that patients who have overcritical or hostile family members, they tend to be having difficulty in regards to achieving recovery in their life. Okay, so good family support is also a vital component in recovery. Open-minded society is also important because we can see that if there's less stigma, our patients can actually do more in terms of working field, in terms of their life also. Okay, so these are the 5 factors that is actually important in talking about recovery in mental illness. So when we talk about recovery, there's actually these 4 treatment outcomes. Okay, the first and foremost is good social functioning. Okay, what I mean by this slide is that, okay, our patients can actually reach different levels of treatment outcomes. Okay, so some, if they are very, if they get the right treatment at the right at an earlier time, and they are adherent to the treatment, they can actually recover and be having good social functioning. On the other hand, some may also be having social functioning which are slightly flawed. The third one, they can have social functioning which is seriously damaged. And last but not least, the treatment outcome can also be in the most disadvantaged form, in which they probably suffer from chronic mental regression. So I will go one by one with regards to each criteria. So when we talk about those having good social functioning, they actually have complete disappearance of the symptoms. They don't have the symptoms altogether. They probably do not have anymore their hallucinations or their depressive mood. So in terms of cognitive ability, self-care, social skills, they are actually as normal as other people. Okay, people would not know that they actually have mental illness. And in terms of their working ability, it's actually similar to the period before the mental illness. So these group of patients, they are the most advantaged one. Okay, they can return back to the good social functioning. Okay, secondly, the second level is social functioning slightly flawed. Okay, what I meant by this is that they probably have some symptoms, but probably the symptoms are not apparent. It's probably some residual voices or residual mood symptoms. It's not as prominent, okay, but they still have it as compared to the previous one. They don't have at all. Okay, in terms of their cognitive ability, self-care, social skills, it's slightly weaker as compared to other people. They may be slow in terms of responding in their daily conversations, and they may find it a bit hard to resume professional jobs. And so this group of people, this group of patients, they need to adjust their expectations based on the current condition. Okay, so they can still work, they can still function, but probably the level of work that they can achieve, it's not as high as before, because they still have some impairment in terms of their cognitive, their thinking skill, their capacity to self-care, and in terms of their social skills. All right. Thirdly, when we talk about social functioning seriously damaged, this group of patients or this group of people, their symptoms are obvious, okay? And they probably need other people to take care of them. They don't have the capacity to socialize as well as others. And this group of people, they can still work, but it's best for them to be in a sheltered workshop. Sheltered workshop, it's like a protective environment, you know. They have a sort of a person to monitor what they do, you know, and to guide them accordingly. All right. So last but not least, the fourth treatment outcome, the most bottom one, is those having chronic mental regression. So this group of patients, their negative symptoms are very obvious. Okay, and some positive symptoms such as hallucination and delusion will still remain. Okay, what we mean by negative symptoms are the negative symptoms, because in schizophrenia, or for example, they can have varied symptoms, like the symptoms can vary. Although it's they may appear, the negative symptoms are like, they may appear like they're not motivated. Some people may misunderstood them for being lazy or for being depressed, but it's actually part of the symptoms. They still suffer from the symptoms of the illness. And when we talk about positive symptoms of schizophrenia, for example, it's not to say that it's very positive, but it's just that it's more apparent as compared to the negative symptom, because when they are being in their hallucination form, they're hearing voices, it's rather prominent. Okay, so this group of people, they are usually detached from the society. They highly depend on others to take care of them, and they may require long-term hospitalization. So this group of people, they can only receive basic living training. So in terms of recovery for them, it's probably targeting with regards to, for them to be able to take care of their own self. You can only receive basic living training. They can't afford to be trained more than that, because they have been impaired for significantly. Okay, so this is a summary of all the 4 treatment outcomes that I have described earlier. Okay, good social functioning slightly flawed, social functioning seriously damaged, and chronic mental regression. Okay, so when we talk about the levels of recovery mentioned just now, right? The 4 treatment outcomes, all these, you know, for the patient to be reaching these 4, the outcome of this treatment actually is dependent on these factors. Okay, with regards to the levels of recovery depends on whether they are receiving the medical treatment in the first place. Okay, for example, if let's say they have been in their unwell period for so long and they have been delayed from getting the medical treatment, their brain function or their brain capacity have probably been impaired quite bad, that they probably are not able to be achieving the good social functioning. So that is one of the usual reason why our patients are not able to recover as good. Okay, so other levels of recovery depends on psychological counseling. For example, if those having depression, they receive adequate counseling, psychological counseling on top of the medical treatment, they probably could be as good in terms of recovering. Uh, Thirdly, rehab service. Rehab service, if for example in Penang GH, we do have our occupational therapists to be guiding our patients in terms of doing the daily activities or doing the daily chores like cooking, all the basic skills to train them back. So this is also very important because as we can see, when our patients suffer from mental illness, their ability or their capacity to be doing what they used to do before may have been impaired significantly. So they need to be guided back. So rehab service is also important in improving recovery for our patients. People's care and concern, the more people care about them, the better they are. Okay, because not to forget, they are also humans and they also have feelings. So they actually do better if people care about them. Because for example, those patients who come to our clinic accompanied by their family members, we can actually know for sure that their condition is actually how it's being described by them and also by their family members, because there's someone who is accompanying them. All right. And last but not least, social acceptance is also important because as we all know, our patients who face a lot of stigma, they can't get back to the community, and even the family also is suffering from sometimes feeling embarrassed, ashamed if they are being stigmatized by the public. All right. So next, I will be talking with regards to what would be the factors attributing to poor treatment outcomes. Okay, so what we have seen is that those who develop mental illness at an early age, they are likely to suffer more, and they probably have poorer in terms of treatment outcomes. Okay, because if they develop illness at an early age, it's the age where they are learning things, they are productive. So if they are already impaired at an early age, they actually have they usually show poorer treatment outcomes lah. Next, those who suffer acute symptoms and those condition deteriorated rapidly, they also show poor treatment outcomes. Of course, those who do not receive formal treatments in terms of medications, counseling, rehab, they also do not show good treatment outcomes. And those who are not taking the right dose of medications also are among those who are actually showing poor treatment outcomes. Okay. So now, this is also important to highlight the role of family in recovery. Okay, so as mentioned just now, we have 4 treatment outcomes, right? The first is good social functioning. The second is social functioning slightly flawed. The third is social functioning seriously damaged. And the fourth is chronic mental regression. Okay, so I will be going through one by one with regards to these criteria, and what if let's say our family members in this particular category, how we can actually help them, what are our roles in helping them. Okay, so let's say if our family with mental illness are in the good social functioning level, okay, so what we can do is to express care, to express support for them. Okay, since they are doing very well, so we should always show our continuous support for them, and we should always encourage the person to express his or her needs. And not to forget, They also need to make sure that they follow the doctor's advice to take medications accordingly and not to stop medications unless indicated lah. Okay, to prevent relapse. Okay, this is very important because there's a lot of misconception out there that our the patients with psychiatric illness have reached good social functioning, they don't need to take medications anymore. So that's actually a very dangerous misperception. Okay, so yeah. So next, if let's say our family members with mental illness are categorized in the second category, which is social functioning slightly flawed. Okay, what we can do as family members is that we should assist the person to adjust their self expectations and also accept the fact that his or her ability may be slightly weaker than others due to the illness. Okay, because as mentioned just now, although this group of people, they don't really have symptoms that's quite obvious, but it's still affecting them somehow. Rather, they still could not actually perform as good as before. So we need to sort of help them with regards to adjusting their self expectations, okay, so that they don't continuously be disappointed with themselves, right? Okay, we should also be helping this person with mental illness to seek the most appropriate treatment. This is also important, and we should monitor the changes in the person's mental health and prevent relapses. Okay, they should be monitored regularly, and it's very important to prevent relapse in this group of population so that they don't become worse. All right. Thirdly, okay, if their social functioning is seriously damaged, what we can do as the family members is to also help the person to seek the most appropriate treatment. Treatment is very important, okay? And we should also support in terms of his or her daily life and help in terms of increasing his or her ability to take care of himself or herself. Okay, the least that they can do is to take care of themselves well. So we should help as much as possible and support them in that sense. Okay, and although their social functioning is seriously damaged, we can still help the person to expand their social circle and reintegrate back into society. Like as mentioned before, for example, they can be actually working in a sheltered workshop. So when they work in a sheltered workshop, they can actually meet others there and probably make some friends with those having similar condition as them. Okay, so last but not least, for those in the category of chronic mental regression, this group of people, the family members should be helping in terms of helping the person to participate in their basic living skills. Try as much as possible to engage them, to be doing things at home, like doing simple chores or simple things lah, like taking their bath. Help him or her to stay in touch with society. All right, that's also one of the good way to help them, because they may be very in their own world. Okay, so all right, in terms of hope for recovery, all right, what we have to do in terms of being a family member with those with mental illness, we should help as much as possible to make our family members with mental illness to develop the awareness that he or she is ill. Okay, because not everyone with mental illness recognize his or her own illness at the outset, because when persons with mental illness, when they are disturbed by the symptoms, their thoughts are actually affected by the illness. Okay, they can't think as usual because their thoughts are influenced. Their thinking are very much influenced by their symptoms. Okay, they have difficulty in deciding also whether their mental health is in a normal or abnormal condition, because sometimes when the auditory hallucinations or the voices that they hear, it can be very clear and very it seems like a normal voice to them, so they can't distinguish whether it's actually voices or it's actually abnormal. So we need to help them to acknowledge that. Okay, and they also have difficulty because they usually do not believe that their thoughts, their emotions are actually out of tune with reality. So these are very difficult for those with mental illness. Okay, this probably among the reasons why they are actually having difficulty to have better understanding that they are actually ill. Okay, so people with lack of insight, people who do not actually believe truly that they have mental illness, they usually don't think that they need to receive treatments, right? They don't think that they are ill. They don't trust anyone who says that they are ill, and they don't agree that they need rehab. Okay, so this can be quite frustrating for family members also, because as much as possible, family members want to help and want them to be taking medications, go for rehab, and things like that, right? But family members should also try to understand in terms of how that particular person with mental illness perceive his or her condition. Okay, we should not be making any premature conclusive statement about that particular person's condition, and we should also not be forcing that person to accept that he or she is mentally ill. So what we can do instead, in terms of strengthening a person's awareness, we should be having an open attitude. We should try to be optimistic, okay? And we should try to guide the person to express themselves better. And probably if they can still think, we can sort of compare and contrast, for example, asking them to sort of reflect what would be their different conditions before and after an episode. Like how were they before the episode of illness, and how are they after, when they have been receiving medications, for example. So probably they can see better in that sense. Okay, now let's talk about Mandy. Okay, the story of Mandy. Mandy is 2.5 years old and is still learning to speak. Okay, so one day, Mandy's parents took her out for a meal. Her father ordered a bowl of meat for Mandy, but Mandy refused to eat after just taking just a few spoonfuls of the meat. So then what happened to Mandy was her mother yelled at her. Her mother said, "Didn't you say you wanted to eat me? Why are you eating so little? Do you have any idea how ungrateful you are?" So Mandy was scolded by the mother for not eating the meat because she was the one asking for the meat. Okay? After being scolded, Mandy then cried loudly. Her father, not wanting to waste the food, ate the remaining meat. And he frowned at the first sip and said, "Mandy is not to blame because the meat has turned sour and spoiled." So what do you think of this story? Actually, Mandy is only 2.5 years old and Mandy is still learning to speak, right? So basically what happened here is that the communication that happened, it's because of the mother being too judgmental before actually finding out what was the real situation. So it's rather similar with our patients with mental illness. Sometimes they don't really know how to express themselves, how to express their emotions. Okay, and they are easily being accused or being judged for doing things in a different manner, although they don't intend to be doing it in such a way. Okay, like for example, okay, we should avoid misinterpreting a person's behavior. For example, if let's say our family member with mental illness tend to be sleeping all day, so some of the feedback that I heard from the family members is that they presume that particular person is lazy. Okay, but actually, when our patient or someone with mental illness sleeps all day, it can also be due to the symptoms of the illness. Okay, the negative symptoms I was talking about is part of the symptom, and it can also be due to the side effects of the medications, because we do have medications that can cause our patients to be sedated. So it can actually there's actually other meanings that could possibly explain why such a person behave in a manner, instead of just accusing that particular person being lazy. Okay. Secondly, if let's say a particular person attacks you, okay, you would think that, oh, this particular person hate you so much, it's due to hatred. All right, but actually probably what the particular person with mental illness is having at that point of time is auditory hallucination, part of the symptoms of the schizophrenia. And or probably they fail to find appropriate channels to express the anger. Okay, they don't know how to express themselves. Okay, so they did it in such a manner. So they're still not the one to blame lah. And thirdly, if let's say she or he accuse you of harming him or her, sometimes we tend to be just accusing that particular person to be acting malice, but they probably are disturbed by the voices, like the previous case. Um, and last but not least, for example, if a particular person do not respond to what we say, we tend to think that, oh, probably they just pretending not to hear anything. They just pretend don't want to hear. Okay, but probably it's not that. They probably have some negative symptom. So sometimes it's easy to misinterpret a person's with mental illness behavior, but we try to be understanding and try to look it at a different angle so that, we can have a better relationship with those with mental illness. Okay. Enhancing knowledge of mental illness and having a forgiving heart will reduce misunderstanding and friction between people with mental illness and family members. Okay, so this is also very important. We should have a forgiving heart, which can actually reduce the misunderstanding, and we can have a better relationship with our family members who have mental illness. All right. So here I would like to share on some practical tips on how we can help in terms of improving uh, the relationship with our family members with mental illness. Okay. First and foremost, try to address his or her request. Okay, whenever there's a request from him or her, try to address what is the request instead of dismissing, because they would then be feeling appreciated, if they are being entertained in terms of their request. Provide normal condition for living, learning, and working, because they are also humans. They also have heart. They are also humans with heart, emotions. So they need to be provided normal condition for living, learning, working. Okay. We try to understand person's abnormal behavior and habit. Okay. If let's say they behave abnormally, try to ask them why they behave in such a way. Sometimes they can actually tell that it's actually commands from the voices, or it's actually because of feeling restlessness secondary to after taking the medication. So we try to ask instead of just judge or assume. Okay. And then if let's say their request is unreasonable, explain to them. Okay, explain to them patiently. If their request is unreasonable, we should not be laughing at them, we should not be ignoring them also. Last but not least, we should also help the person to live a regular life, maintain social contact, and also get involved in the community. All right. Okay, so moving on to the last part of my presentation, I'll be talking a bit with regards to the rehabilitation team. Okay, because sometimes we get confused. Who is the psychologist? Who's the psychiatrist? What is the meaning behind them? Okay, so actually in psychiatry we work in a multidisciplinary manner. So there's actually a team to help our patients with psychiatric illness. Okay, so usually it is comprising of the psychiatrist or medical officer, the clinical psychologist, the pharmacist, social worker, psychiatry nurses, and also the OT or occupational therapist. So who is the psychiatrist or medical officer? Okay, the psychiatrist or medical officer are actually trained medical doctors. They are medical doctors. They can diagnose mental health disorder clinically. They can be able to prescribe medications also for the patients. And with trainings, they can also conduct psychotherapy sessions. All right. So for example, psychiatrists, we have Dr. Teh here. All right. Secondly, the clinical psychologist. Clinical psychologists, they can conduct psychological evaluation. They can conduct psychotherapy for the patients, but they are not trained in medicine. They are being referred by doctors. They're not doctors in the first place. Okay, for our patients to be receiving the intervention or the therapy sessions by our clinical psychologists, our doctors need to refer patients to them. Okay, so however, due to the limited number of clinical psychologists, this service may not be accessible to all patients. Okay, like in Penang, so far we only have 2 of them, so it's rather limited. Okay, next is psychiatry nurses. Okay, psychiatry nurses can be the resident nurses, can be the community nurses. We do have psychiatric nurses taking care of our patients in the ward, but we also have our nurses going around for home visits to deliver medications for our psychiatric patients. Okay, so these psychiatric nurses, they receive special training in psychiatry. Okay, they can execute some treatment plans. They can administer the medications that is indented by doctor. They are actually the middle person. They serve as the intermediaries between doctors, between the doctors, ill persons, and also family members. And they can actually initiate support for patient and family. All right. Uh, Pharmacist is also a part of the rehab team. Okay, because pharmacists, they prepare, they review, and they dispense medications. They also check whether medication distributed are the same as prescribed by doctors. So what they do basically is with regards to the medications lah. They check the medications, they can explain the properties of medications, the methods, the number of times to be taken, and also what are the potential side effects. So if let's say you have any concerns with regards to medications, you can also address the concerns to the pharmacist. They can actually explain better in the sense. All right. Okay, occupational therapists. Okay, what they do is they can actually conduct assessment of vocational skills for people with mental illness. Okay, vocational skills are like, skills with regards to helping our patients to get back to work. They can actually help people to devise individual plans for living skill development and vocational training. And they provide training to enhance their abilities for self-care and work. All right. So, for example, the occupational therapist that we have in our hospital, she actually has a daycare session, so she can train our patients to do their daily living, ADL we call it, teach them to take care of their hygiene, teach them to cook, do the domestic activities, and also they actually help in terms of helping our patients to find work. Okay, so they actually play a big role in the rehab process of our patients. Okay, so I hope the objectives of my presentation today are achieved. Okay, as mentioned, the objectives that I would like to highlight from this presentation is for us to realistically understand the concept of recovery and rehab. Secondly, to find a level of expectation that is both practical and acceptable. Okay, and actively we work out what are the achievable goals within that level. And last but not least, for us to be better informed about the relevant mental health rehab professionals and know how to express our needs when we want to seek help. Okay, so yep, that's all from my part. Okay, thank you very much.
Okay, thank you, Dr. Nazirah. Um,